comprehensive cancer center, you're most likely to get the most accurate diagnosis and the most comprehensive and up-to-date treatment plan. Comprehensive cancer centers provide the latest treatments, the cutting-edge clinical trials, and are doing the discovery which will create the treatments of tomorrow.
We want to make sure that each individual receives the best therapy, the most effective therapy for that type of cancer that is. Cancers are not all created equal. More and more we learn about differences between lung cancers, breast cancers, colorectal cancers, and so forth. And in order to make the best individualized treatment recommendation for the patient, we need to know about the genomics of that tumor.
By sequencing the tumor, then you know what is driving that tumor, and you can try to turn off the drivers with specific drugs. It's been proven in practice that you have better outcomes if you turn off the gene that your tumor is addicted to.
The only way to really innovate and improve is through research. So research is an important part of what we do here, and I think ultimately helps all of us to take better care of patients in the future.
It's important to realize that every single drug that we use to cure patients today was established through clinical research and a clinical trial in the past.
There have been decades of investment in our understanding of the biology of our immune cells and how they fight cancer, and we're now leveraging, 3 decades later, all of that information to design personalized forms of immunotherapy that are based on educating a patient's own immune cells to fight their cancer.
The Wesley Center for Immunotherapy has allowed us to very rapidly take these therapies into patients. There's only a handful of places in the US that can take a person's cells out of their bodies, modify them genetically so that they can identify cancer, grow them in the lab, and then infuse them back into the patient. And because we can generate those therapies here on site, we can do it much quicker and much cheaper than what's available commercially.
We recognize that when a patient and their family are faced with a new diagnosis of cancer, their world is turned upside down, and there's all sorts of anxieties and stress that surround such a diagnosis. So recognizing that, we think that it's not only critical that we're able to offer them innovative therapies to give them a chance to live longer, sometimes be cured of their cancer, but also speak to them in a way that gives them that hope.
They treated me like I was a mom with 2 sons at home that I need to get home to. They treated me like I was a person with a name and a face and a history and a future, and I felt that.